Good morning, everybody. Welcome to the Vitalyst 101 for the month of November. We'll get started in just a moment as we await more folks to join from the waiting room. It might be a cozy group, but that's all right because it's a cozy morning. Feel free to utilize the chat function to introduce yourself and your organization and where you're calling in from today.
Good morning, David. I'm just signing on. Were you addressing me?
No,
Oh,
we're just awaiting folks to get started here or to join the room here. We'll
thank
get
you.
started in
Lovely.
just a moment. Feel free to introduce yourself in the chat room where you're calling in from, what organization you represent. Thanks for joining, Lisa. Let's go ahead and get started. And then we'll continue to let folks in from the Zoom room. Hi, Joy. Thanks for joining. I am David Martinez. I am the Director of Grants and Civic Health for Vitalyst Health Foundation, joined by my colleague Michelle Goodthunder, who helps me tremendously with our grants and partnership team. We're glad to have you part of our monthly live Vitalyst 101 so that folks can learn more about Vitalyst Health Foundation, our mission areas, our priority areas, and our responsive grant making program, and to see alignment for potential partnership opportunities. Um, the we are do our best to practice accessibility in all aspects of Vitalyst, including this webinar. So here are some accessibility resources we have, including an email address for those that prefer to speak Spanish in their communications. We have closed captioning available through the Zoom services. All the lines are muted, but we'll have a live Q&A session at the end of the slide deck presentation. But feel free to use the Zoom room chat to put in your questions, and Michelle may be able to facilitate those questions as we go along and certainly raise those at the end. We are recording this, and all of the slide decks, materials, this recording will be sent to all participants who registered after. But you can visit vitalysthealth.org partnership page for more information. So for those who don't know, Vitalyst is based here in Phoenix. So we have partnerships across the great state 48. Our vision is that all individuals across the state of Arizona and our communities are healthy and resilient. And we are on a mission to connect, support, and inform those efforts that are improving the health of our neighbors and communities in Arizona. So as I mentioned, we're based here in Phoenix, but we have partners across the state of Arizona. So don't feel you have to be based in the great state of Maricopa County in order to partner with Vitalyst. In fact, we've done a lot of efforts to build and deepen relationships, especially in those communities and populations that have the greatest disparities in health, including rural, tribal, and borderland communities. The mission of Vitalyst is framed to improve health, but we see health as more than just health care. We look at the broader social determinants of health, or what we call the elements of a healthy community. You might have seen the wheel, as we affectionately call it, that reflects the different components of the elements of healthy community. This is an important visual because if you're thinking, all right, I'm not quite in the healthcare space, is there alignment with my organization and Vitalyst? Because we look at the broader social determinants of health or these elements of a healthy community, our mission alignment is pretty broad. And we use this visual to help guide folks to see themselves in the intersection of health and their entities. So you might not necessarily see your specific mission area or programmatic areas reflected in each of these spokes of the wheel. But each one encompasses a whole variety of aspects that might closer align. And if you go to vitalysthealth.org or do an internet search for the elements of a healthy community will, you'll be able to take a deeper dive into the will and to see the more specific components of each of the spokes of the will, including specific health indicators and health outcomes connected with each of those. But you can see we have a wide variety of mission alignment areas utilizing the will because we do see health reflected in all policies and in all aspects of this work. An important aspect for Vitalyst is the intersectionality of all of this. So our work is really at the center of this, including centering health equity and resiliency efforts. At Vitalyst, we advance our mission through three primary goals, focused on collaborative networks that are improving the conditions that impact health, ensuring that those collaborative networks are made up of strong community partners that are equipped to advance health equity. And we do a whole lot to inform decision makers, support efforts that inform decision makers that are prioritizing community health and well-being. These goals are really important because it describes kind of how and the emphasis that Vitalyst has in looking at partnerships. As a health foundation, we follow a general public health mentality and working upstream, supporting upstream interventions to improve health, which means that those interventions are tackling the root causes of the greatest health disparities in our state rather than, say, downstream interventions, which are much more programmatic or direct service work. Still very important work, but we're really trying to tackle those upstream interventions. A perfect example I use of this, because I used to work in food banking, is very rarely will you see Vitalyst support through programmatic or grant support our food banks here in Arizona. They do amazing work, especially these days, going into the holidays, of course, and with everything happening with the federal government, the impacts of the SNAP food stamp program. But very rarely will you see us support just general distribution of food boxes that the food banks do to alleviate hunger. What we do want to tackle is those root causes of why people are experiencing hunger in the first place. Why are people going to the food bank in the first place? So really looking at that food systems approach, the root causes of hunger and food insecurity. So in that effort, it's hard work. And it takes a village, it takes a coalition, which is why we focus our efforts on collaborative networks, but of course, recognizing that those networks are made up of individual organizations that they themselves need to be strengthened. So work to strengthen those community partners. And those upstream interventions often include some sort of policy or systems change, which is why we do a lot of work around informing decision makers, both leveraging Vitalyst voice for advocacy and public policy, but also supporting efforts that are engaging in policy and practice change. I like to frame Vitalyst as kind of three sides of the house. One side of the house is our fiscal sponsorship program called the Technical Assistance Partnership of Arizona, or TAP-AZ, which provides back office finance and accounting support for organizations that do not yet have a 501(c)(3) or are just simply a non-registered entity in that way, like a coalition. Or even if you are a 501(c)(3), there are different types of fiscal sponsorship that TAP-AZ offers for fiscal sponsorship and nonprofit organizations that want to focus on their mission and programmatic areas and not so much have the capacity around that back office finance and accounting support. If you want more information about that side of the house for Vitalyst, just visit tapaz.org. On the website, you'll also find that they have a similar monthly TAP-AZ 101, so you can learn more about fiscal sponsorship and that process to explore to boost your capacity on that areas. The other side of the house is our responsive grant making program that I'll touch base in just a little bit. Like most foundations, we have that grant making side of our house. And then on the other side of the house, we operate a little bit differently than some foundations in that we have programmatic priority areas that we outline every year in consultation with community partners, and we have a director that oversees each one of these portfolio areas. This year, and they don't swing too much from year to year, they're kind of longer term based on the urgent needs of our state, top health inequities in our state, and those have been civic health, healthcare integration, and housing. So in those programmatic priority areas, we have activities that connect with each of our three goals. So, for instance, I direct our civic health program in addition to the grants program at Vitalyst Health Foundation. So, in our civic health portfolio, we still look at those systems approaches to how communities come together to tackle their toughest challenges. And in our case, since we're a health foundation, how those communities are coming together to improve the health of those of their neighbors, their communities, our state, and we think that boils up to our country and our democracy. So those systemic levers in civic health are around the census, redistricting, and voting access. So Vitalist does a lot of collaborative networks working in that space, strengthening community partners within the civic health space, and a lot of advocacy and public policy to inform decision makers about the importance of the census, redistricting, and voting access, as well as this connection that civic engagement and civic participation are inexplicably linked to health outcomes and good health policy outcomes. So again, you see that kind of upstream approach and then the focus in each of our three goal areas. Similarly, our colleagues in the healthcare integration and housing portfolio have similar efforts. You see here my colleague Anna Rossetti, she directs our healthcare integration work. She has been really busy this year working to support collaborative networks, especially around the Medicaid space, access and kids care here in Arizona with the pending cuts because of federal actions. Working primarily with Cover Arizona Coalition to help Arizonans navigate healthcare systems with open enrollment happening now. It is definitely top of mind. And then, of course, preparing with community health centers and that coalition, the impacts of the pending Medicaid cuts and new work requirements that are being implemented here in Arizona. She also works to strengthen community partners in a lot of different public health areas, including maternal and child health, vaccine confidence, healthcare workforce, a lot of different issues connected with the state health insurance or health improvement plan and that strengthened community partners. Anna also is our lead advocate at the state capitol and on policy issues. So she is our state health advocacy director and does a lot of informing decision makers and facilitates the legislative priorities for Vitalyst Health Foundation, especially as they're connected to healthcare, but also civic health and housing. It really is this connection that the physical, mental, and social determinants of health are all connected, and her portfolio shows that. Our colleague Gabriel there in the snazzy blue blazer directs our housing portfolio, which again has activities in each of those three goal areas, especially supporting the collaborative network called the Arizona Housing Coalition, which takes a lead role in our state advancing health policy. Still working to strengthen community partners, especially to show promising practices in especially workforce affordable housing across the country, building relationships with what we call anchor institutions like schools, churches, community colleges, um, federally qualified health centers who have vacant land and want to leverage it to build workforce affordable housing. So we make those connections to nonprofit affordable housing developers who can collaborate and meet that need in those communities. We have some really great projects as part of our housing portfolio with the Flagstaff schools up in the White Mountains and in various other school districts and areas across the state. And then our colleague Sergio Paris, the fourth mug there, is our Director of Strategic Communications. He helps tell our story and the stories of our partners and projects in a variety of ways. He also, based on his experience, facilitates conversations with prospective partners that specifically are working in the food systems and educational system work because of his experience both at previously at an education foundation and in the food system work. So those are the directors of Vitalyst Health Foundation. And I mention that because those folks, including our colleague Michelle, help facilitate introductory conversations when we're beginning to explore partnership, explore especially as part of our responsive grant making program, which again is that third side of the house of Vitalyst. So we have TAP AZ, the fiscal sponsorship, our programmatic priority areas, civic health, healthcare, and housing, and then our responsive grant making program, which is our grant making side of the house. So that grant making side of the house is comprised of three different grant types. The first grant is the technical assistance grant, the second tier is a Spark grant, and the third tier is a systems change grant. In total, this is a 5-year grant potential for up to $225,000 if you start at tier one, the technical assistance grants, and then have the opportunity to move up to year two, and then year three, four, and five with the systems change grant. We've heard a lot of feedback from our grant partners over the last decade that we've administered this grants program, recognizing that systems change is hard work. It takes a village. It takes a long time. It takes a lot of resources. So we have aligned all of our grant opportunities to be structured as this kind of scaffolding approach to help collaboratives build up their capacity, plan, and implement towards systems change. So what does that all mean? We'll take a deep dive in just a couple of slides on this, but as I mentioned, as you see alignment with Vitalyst, both mission-wise and for one of our grant-making types, we have an open door policy. So anybody can visit vitalysthealth.org, complete what we call our discovery intake process, which we use to discover partnerships, get it? And that discovery intake process simply collects some basic information about your organization, the lead applicant, the collaborative that you're hoping to form or that you formed working towards systems change, and which grant type you see as most aligned based on what you're learning today. So again, anybody can go to vitalysthealth.org, complete that discovery intake form, and then once we receive it, we'll review it and see if there is alignment, and if there is, then you'll be prompted to schedule a time to chat with one of the four directors or our colleague Michelle to have an introductory consultation call. Who you talk to depends on what your systems change project and your collaborative is working on. So if it is a housing collaborative, you would be directed to have that initial consultation with our colleague Gabriel, who directs our housing portfolio. Similarly, in food systems or the educational system, you'll have that initial conversation with Sergio, who facilitates those relationships. If you're in the broader healthcare space, that's our colleague Anna. And then in the civic health space and also kind of a catch-all Renaissance man, you'll talk with me or have an introductory call with Michelle, as I noted. So if you're going through this webinar and you're thinking, yes, I'm totally aligned, I think we're forming or have a coalition, a collaborative working towards systems change, and we are aligned with one of those three grant types, I recommend you go to vitalysthealth.org and begin that discovery intake process. So now let's take a deeper dive into each of our three grant types. So the first one, as I mentioned, is our technical assistance grant. This is the first tier of our grants program, and it's meant as a collaborative capacity building grant to allow those collaboratives that want to form and eventually plan and implement a systems change to have the space and grace to build up that collaborative. We know that coalition work is hard and it takes time, it takes a village, it takes a lot of trust and relationship building, and sometimes aspects of like a neutral facilitator to bring the right partners to the table and build up the coalition so that it's in a better position with a strong infrastructure to then plan and implement a systems change. You'll see the 5 criteria pieces for the technical assistance grants. These are the same 5 grant criteria for all of our grants across the tiers. So you'll see this repeated. It just really depends on where your coalition or collaborative is at in their journey towards systems change. So if your collaborative is barely forming, or even if you're just one entity wanting to form a collaborative, you'll likely be most aligned as a technical assistance grants partner to spend, again, some time to build up the capacity of that collaborative to eventually plan and implement a systems change. So in this criteria, the collaborative criteria is a big aspect of it, weighted heavily to ensure that the effort of that grant will help build the capacity of the collaborative. The collaborative still has to be working towards some sort of health outcome, improving the health outcome. And again, we use that will to help frame those health outcomes that you're hoping to achieve. All of our grants are framed as a systems change approach rather than, again, those downstream interventions. So if you're just doing programmatic or direct service work, you're not aligned with Vitalyst grant types. We more so focus on collaboratives working towards systems change. So in this point, the systems change as a collaborative doesn't, the specific intervention or the change that you want to have happened doesn't have to specifically be spelled out or planned for. You just have to know what system you're working in and hoping to change and have that kind of systems change thinking as your intervention rather than, again, those downstream programmatic or direct service work. So the systems change criteria is still important just to make sure that your thinking is in the systems thinking framework, but you don't have to have it completely spelled out. We hold an equity lens, as I mentioned, describing the will in all of the aspects of Vitalyst, including our grant making program. So there's a health equity criteria for our grants. This is to ensure that, especially connected to the health outcome criteria, that you're eventually looking to a specific health disparity to tackle. So for instance, if you're working to improve diabetes rates in Arizona, we would want you to eventually focus in on a particular population or community that has the greatest disparity in diabetes rates in Arizona. So it might be in the Black and African American community in South Phoenix, for instance. I don't know if that's the actual data, but just as an example. Another health equity criteria is we often say those closest to the problem are closest to the solution. So this is really engaging those community members with lived experiences connected with that health outcome to be part of your collaborative and help you build up that effort and eventually plan and implement your systems change. And then for the budget criteria, we have a budget template to submit that showcases what your work will be for and the expenses will be for the technical assistance grant and how that is consistent with the proposed scope of work. In this case, the technical assistance grant is a up to $20,000 grant for up to 1 year. And we say up to in both of those instances because it really does depend on what your specific capacity building effort is in for your collaborative. So the collaborative might have a really specific need and to address via technical assistance support, and that's what would be covered and to be addressed with the technical assistance grant. So it might be a shorter amount of time and a shorter amount of funding needed to meet that capacity building need. This is most often seen and done by connecting with a strong local consultant or coach who can help you meet those capacity building needs. So often the technical assistance grant connects you with a local consultant and coach that can help you meet those capacity building needs. And those can look like a lot of different things. Like I mentioned, it could be facilitating introductory conversations and identifying who are those core partners that should be part of your collaborative to help you advance your systems change. It could be building up trust and relationships in that collaborative, setting up the infrastructure, the bylaws, if you want to get that formal around the structure and the governance of your bylaws, and beginning to think about what would make that collaborative strong. So in this instance, again, the technical assistance grant often covers the compensation of a consultant. And in that frame, we usually work with you to identify a consultant that can help best meet your needs and work with them collaboratively to draft a proposed scope of work that would help address your capacity building needs and then include that as part of your proposal and what would be funded for up to $20,000. So for the technical assistance grants, Like all of our grants, we explore these through our discovery intake process. So again, go to vitalysthealth.org and on our partnership grants and partnership webpage, you'll see the discovery intake form. So you'll complete that. And if you see alignment with the technical assistance grant, you select interest in that, and that's what we'll receive. Anybody can explore and discover partnership with Vitalyst, do this through the discovery, and the technical assistance grants have to go through the discovery intake process so we can have that initial consultation. So once you submit it, we'll review, and if aligned, you'll be prompted to schedule a time with a Vitalyst director via Calendly to set up a 30-minute virtual call, introductory, to get to know more about your collaborative and what you see, how you see that alignment with the technical assistance grants. Then, if the director determines, yes, this is aligned as a technical assistance grant, a collaborative working towards systems change that needs collaborative capacity building, then they'll work with you to draft that proposal. You still have to draft it, but and get the proposal from the consultant that you might be working with. But as you begin to draft it, hitting those 5 criteria points, each director will review it and see if it does indeed align strongly with the criteria points. And once it gets to a position of readiness, then that director will invite you to submit that application through our online grants management system portal. And then it'll go through our review process. These do not have to go forward to our board for approval, so we have set up an internal review process and review them on an ongoing basis as they come through our team. Usually there's about a 2-week review period, and then a week after that, if consensus is reached to formalize the partnership and get the awards out. So pretty quick turnaround here. But again, no deadline for the technical assistance grant. We review those through the discovery intake process throughout the year. The next tier of our grants program is the Spark Grant. So again, the second tier of our 3-tiered grants program. This is meant for those collaboratives that have formed up their capacity. Now they're ready to plan towards their systems change. So you can consider this kind of a planning grant. Again, you'll see the 5 criteria, the same 5 criteria as the technical assistance grant here. But again, your collaborative is a little bit further in your journey towards systems change. At this point, you have formed your coalition, your collaborative. You might still need a little bit of building to be done, and that's okay. But you have your core partners as part of your collaborative ready to begin planning what your specific interventions or solutions are towards systems change. So that's the criteria around the collaborative. You still have to be working to improve a specific health outcome, and we hope throughout this period you get even more specificity with what that specific health outcome is that you hope to achieve. And of course, you still have to frame your efforts as systems change. This effort in the Spark Grant is to plan the specific interventions and solutions towards systems change. So you'll know the system you're working in, you'll know the change that needs to happen, the barriers that exist that are restricting specific improvements in health outcomes or keeping the health disparity in place, and then how you hope to change that system. The health equity criteria is still a key component. Hopefully continuing to engage those community members with lived experience as part of your collaborative and planning, and also beginning to think about the more specific health outcome, the population and communities with the greatest health disparities of that health outcome. And then the budget criteria here, you'll have another budget template to submit and a narrative to reflect how your proposed budget is consistent with the scope of work. The Spark Grant is a 1-year grant of $25,000, again, meant to help you that collaborative plan towards their systems change. We do have a board approval process for the Spark Grant. So we have set up 2 grant cycles each year. The fall deadline just passed. It was in October, and we're working through our board process now. The next deadline will be formally in the spring, but we may also have a Q3 Spark Grant opportunity. So again, you would go through the discovery intake process to review these opportunities, And if you see alignment with the Spark grant, select interest in that. Once we receive it, we'll review it. And if it is aligned, then you'll be prompted to schedule a time to chat with the Vitalyst director. Once again, they'll have that initial consultation with you, a 30-minute virtual call. If it is aligned, they'll work with you to review your draft Spark grant proposal, which hits on those 5 criteria pieces again. And then once they feel it's in a strong position to advance, they will invite you to submit that application for formal review. And then we go through our internal review process, which at this point includes our board grant review committee. And then we go through that board process after each of these deadlines and get our board approval if the staff recommends funding. And finally, we have our third tier, our systems change grants. So this grant is meant for those collaboratives that have been built. They've planned their work. Now they're ready to implement their work. So think of this as an implementation grant. The systems change grant is the highest tier of our grants program, and it's a 3-year grant. Again, focused on systems change efforts. And this at this point of your journey towards systems change, you know your interventions and solutions for systems change. You just need long-term long-term and funding, 3 years and longer term funding to implement your systems change. So the systems change project design criteria is a really key aspect to ensure that your efforts are indeed actually aligned at systems change. Your collaborative at this point should be really built and formed, strong, ready to implement, the right partners at the table, including those most impacted by the health outcomes. For those health outcomes, we really want you to get specific about the specific data and populations, communities that you're hoping to improve the health outcomes of in that frame, and then similarly connected with the health equity criteria, how that data is disaggregated to show that the effort that you're tackling is tackling a great health disparity in Arizona. Of course, also continuing to engage those with lived experiences. And here the budget is a more robust budget. Again, you'll have a template, but this reflects a 3-year grant of up to $175,000 total. So how are you expending the funds throughout those 3 years? What is the total project cost of your systems change effort? Because we know it takes a village. We know systems change takes a lot of time, a lot of resource, well beyond what Vitalyst can even provide. So we look to what the total anticipated project cost will be, and then how Vitalyst grant of $175,000 fits within that. So just as previously, we review systems change grant opportunities. Even though the deadline has passed for this fiscal year, we are still happy to facilitate introductory conversations to help you begin thinking if a systems change grant is where you might be most aligned, because it is likely we will have a new grant cycle in the new fiscal year, very similar for our systems change grant. So at least we can begin the conversations, and then you can begin thinking about aligning more so with that, or going through the technical assistance grant or Spark grant. So still complete the discovery form if you're interested in this. Because this is our larger grants program, we do have the opportunity for groups to simply submit their proposal directly once our portal is open. Again, for this fiscal year, it's already closed. It passed in October, but it opens for generally a 2-month time period at the end of the summer, early fall. And but we highly recommend folks go through that discovery intake form, especially to see if the criteria of systems change is aligned. Once we again complete that, once you complete that discovery intake form, you'll be scheduled. You'll be prompted to schedule time to chat with a director who can provide insights and feedback on that alignment and review draft proposals. For this system change grant, the proposal is 5 pages along with that budget spreadsheet. In the 5 pages, you hit those 5 criteria points, including the budget. You have the opportunity to provide a narrative of your budget expenses in addition to that budget template. Once we receive that, we go through our internal review process which includes our board, again, because this goes through our board approval process. Once we do that first phase of reviews of our written applications, we then select those to advance and present to our grant review team, which again is made up of Vitalyst staff and board members, and present your proposal. We do this kind of two-step grant process for our systems change grant because we recognize a lot of the groups that we work with are grassroots community-based organizations that might not have full-time fundraisers or grant writers. So their written application might not be as strong, but they sure can tell their story really well. And they have that opportunity as an equitable grant making practice to present their proposal. Once we do reviews of those presentations, then we look at the scores and the team decides which to fund for this fiscal year. And we're going through that process now and for board approval in the spring. So that wraps up the responsive grant making side of the Vitalyst Health Foundation house, in addition to the programmatic priority areas of healthcare, integration, housing, and civic health, and our fiscal sponsorship program called TAP-AC. I will now toss it over to Michelle if there were any questions that arose in the chat room. But if you have any questions, feel free to raise your hand and we'll call on you to answer them live.
No questions in the chat room.
Okie doke. Valentina, hello, my friend.
Y'all, so nice to see your faces. Sorry you can't see mine. It's early on a Tuesday. But I was just wondering if basically between Spark and what's the bigger one? I already forgot.
System change grant.
Yes. Like, could you give examples of what would teeter one way or another? Because I think our coalitions are like kind of right in the middle, and I will submit something and do the session, but I'm just curious if there are examples.
Yeah, totally. It really is. The difference is planning versus implementation. So if you have your specific interventions or solutions in mind and you know exactly the strategies and the activities to achieve them, you might be ready for the systems change grant to implement them. You just need, right, a longer runway, a lot more resources to help get those done. If you're still working, if your collaborative is still working on identifying what those specific interventions or solutions are, or even if you have them identified, but yet don't yet know like the specific strategies or activities to implement them, you might be better suited for the Spark grant, the 1 year, $25,000 grant. I do want to mention in this, the discovery consultation call is to kind of tease out these ideas, and each director is knowledgeable now with each of the three grant types and can help you think through which you might be better for. So as you complete the discovery intake form, you might put, I think I'm aligned with the systems change grant, but during the conversation, the director might be like, well, it sounds like you actually are better suited for the Spark grant. So then we'll just put you in that process for the Spark grant rather than have you wait for the next systems change grant cycle. So that's what the conversation is for. I'll
That's
also note,
phenomenal.
Valentina, yeah, brilliant. I'll also note that you don't have to start at square one with the technical assistance grant or even square two with the Spark grant. If your collaborative is formed, if you've done your planning, you're ready to implement, then you could jump straight to the systems change grant. Or if your collaborative is formed, you just need planning, you can jump straight to the Spark grant. So you don't have to go 1, 2, 3. You can go 2, 3, or just 3. There's no guaranteed funding for once you jump to each one. Each has its own application process, and we really work with those partners to ensure that the collaborative is ready to advance as part of our systems change journey. And it really is our intent. That's why we built it out to help folks go deeper in their systems change journey and help you navigate across this continuum. But it's an individual grant cycle for each of those three grant types.
That's super helpful. Thank you. And knowing what to expect from that initial conversation with you all is great. Thank you, David.
Yeah, for sure. Thanks for the question. If you have a question, feel free to use the raise hand function or unmute yourself. It's a pretty cozy group, so Happy to have a conversation. I don't see any or hear none, and don't see any in the Zoom chat room. So don't want to belabor the point, and we'll give you a little bit of your morning back. But as I mentioned, all of the materials, this recording will be sent to you and all those that who registered. We have an open door policy, so if you do see alignment with Vitalyst, please complete the discovery intake form. And if you just have any questions as a follow-up to this, don't hesitate to reach out to us. Thank you all so much for spending a bit of your November morning